Probiotics are microorganisms naturally found in the stomach, intestines, and vagina. They can be found in foods like yogurt, milk, and juices, as well as in dietary supplements like capsules and tablets. Probiotics are used to improve digestion and restore normal flora, especially when the balance of bacteria and yeast is disrupted, such as during antibiotic use or travel. They have been used to treat conditions like diarrhea, irritable bowel, eczema, vaginal yeast infections, lactose intolerance, and urinary tract infections. It is important to check the label of your particular product for information on its specific uses. Be aware that some diet supplement products may contain harmful impurities or additives, so it's best to consult your pharmacist for more details about the brand you are using. Remember, the FDA has not reviewed this product for safety or effectiveness, so it's important to consult your doctor or pharmacist for more information. As for the daily dosage and optimal timing, it's best to follow the instructions on the product label or as recommended by your healthcare provider. When taking kala, be sure to follow the directions on the product package. Check the label to see if the dose should be swallowed whole, chewed, sprinkled onto food, or mixed with liquid. If you're using the liquid form, use a special measuring device to carefully measure the dose. Don't use a household spoon because you may not get the correct dose. If you have any questions, ask your doctor or pharmacist. Some probiotic products may contain live bacteria, such as bifidobacteria. If you're taking antibiotics, these products may not work well. Take any product containing live bacteria at least 2 to 3 hours before or after taking antibiotics. Follow the directions for your specific product. If you're using this product for diarrhea due to antibiotics, don't use it if you have a high fever or for more than 2 days, unless directed by your doctor. You may have a serious problem that requires medical treatment. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. If you experience increased stomach gas or bloating while taking kala, it's important to notify your doctor or pharmacist. Serious side effects that should be reported to your doctor include signs of infection, such as a persistent cough, high fever, or chills. While rare, a severe allergic reaction to kala may occur. Seek medical help immediately if you experience symptoms such as rash, swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you're in the US, report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, report side effects to Health Canada at 1-866-234-2345. As always, consult with your doctor regarding the best time to take kala and the appropriate dosage for your specific needs. Before taking kala, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. If you have certain health issues like prolonged diarrhea, a weakened immune system, or diabetes, it's important to consult your doctor or pharmacist before using kala. If you are pregnant or breastfeeding, talk to your doctor about the risks and benefits of using this product. Additionally, if you are going to have surgery, be sure to inform your doctor about all the medications and products you are using. As always, it's important to follow the recommended dosage and timing for taking kala. When taking kala, it's important to be aware of potential drug interactions that could impact how the medication works or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Some medications that may interact with kala include antibiotics and antifungals such as clotrimazole, ketoconazole, griseofulvin, and nystatin. It's important to consult with your doctor before starting, stopping, or changing the dosage of any medicines while taking kala. Remember to always follow your doctor's approval and guidance. If someone has taken too much kala and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to call 911 immediately. Otherwise, you can contact a poison control center for assistance. In the U.S., residents can reach their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for help. Make sure to attend all your medical and lab appointments as directed by your healthcare provider. It's important to note that some brands of kala may also contain additional ingredients like fiber or inulin. If you have any questions about the specific ingredients in the brand of kala that you are taking, it's best to consult with your doctor or pharmacist for clarification. If you forget to take a dose of kala, take it as soon as you remember. If it's close to the time for your next dose, just wait and take the next one as scheduled. Don't take double the dose to make up for the missed one. Probiotics like kala may have different storage requirements. Some may need to be kept in the refrigerator, while others should not be refrigerated. It's important to check the product package for specific instructions on how to store kala. If you're unsure about storage, it's best to ask your pharmacist for guidance. When it comes to discarding kala, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, the product should be properly discarded when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to dispose of kala. And remember to always keep medications like kala away from children and pets for their safety. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.